Everyone, welcome to my page again. Today I'm going to talk about how to navigate some challenges as a nursing mother breastfeeding their baby. Don't go away, come along with me. Let's discuss this together. The first thing to do is to start to clean your breast, the nipples area, the areola during pregnancy. That is the first thing that you can do to overcome any challenges that can result from not properly taking care of your breast during pregnancy. Even though cleaning the breast may tend to be painful during pregnancy, just encourage yourself to be cleaning the breast during pregnancy. You can be using clean clothes to clean the areola in order to be free of any particle, because when there is particles on your nipples, on your breast after the delivery of your baby, your healthcare providers, they are not going to be encouraged to put your baby to breast with particle on it, because you may not tolerate thorough cleaning after the delivery of your baby because of the stress of the childbirth. So it's very important you clean your breast. It can be with tepid water, with clean clothes during pregnancy. It's not advisable to be using soap. Why? Because of the scump that is going to be left on the breast. So it's advisable for you to use tepid water, clean water, and clothes. Just ensure that the area is clean and the baby will be ready to feed on it immediately after the delivery of the baby. This is very important. Another thing to do to prepare yourself ready to navigate any breastfeeding challenges is that if you notice that you have a flat nipple from pregnancy period, try to be pulling it out yourself and rub it with your fingers frequently during pregnancy. Another thing is to be well hydrated during pregnancy and after the delivery of your baby. This will encourage lactation and more supply of breast milk. Another important thing that you must be very conscious of is that you put your baby to breast after your delivery. Babies that are put to breast master the act of breastfeeding earlier than baby that they delay in putting them to breast. For instance, it's the sucking reflex of the baby that actually initiates breast milk lactation. Babies too, in their own way, they have this act. When they are put to breast, they have to learn that act, even though it's their innate ability to suck breast. But it to have is something that needs to be learned. They have to learn the act of sucking and swallowing the breast milk. Now compared to when the baby is introduced to artificial milk and being fed with spoon and cup, it's so easier to fill them with spoon and cup. They're not doing any extra work at all. Just for the person feeding them, their parents, or the healthcare attendants, just for the person to draw the milk into their mouths. That is so easy for them compared to when they have to master that act of sucking before they master the act and be able to. Is more easier for them to be fed with cup and spoon, and in their own way they can actually sense that. So when you initiate or you introduce feeding them with spoon and cup, they tend to adjust to that method compared to putting them to an extra work to do. So that is why it's so important that all things being equal, if there is not any issue with the woman after the delivery of her baby, it's important to put the baby to breast. Latching and positioning is very essential in breastfeeding your baby, and I've done a video on that which is titled Breastfeeding Awareness, whereby There are video and images, illustration of different positioning and how to have a deep latching when you are feeding your baby. I will implore you to go and watch that video in order to help you more about deep latching and positioning in breastfeeding. After all this being said and being done, if you still see that you are not comfortable, you feel that you are not feeding your baby enough, or there is any other problem apart from all this that I've mentioned, it's better you visit your healthcare provider, the lactation expert, to put you through. You are able and you are capable of breastfeeding your own baby. I've come to the end of this video. Thank you for staying with me to the end. Until next time, I will be doing another video. Take complete charge of your health and your baby's health.